Welcome to Diagnosing Health Care, a podcast featuring thought-provoking conversations about the latest legal, policy, and regulatory issues in healthcare. While these issues may seem like hurdles, we'll also look at the business opportunities and solutions that exist. Diagnosing Healthcare is brought to you by the healthcare lawyers at Epstein Becker Green, a leading law firm that has more than 40 years' experience serving clients in the healthcare industry nationwide.
Hello, everyone, and welcome to Diagnosing Healthcare. I'm your host, Bonnie Scott, and I'm an attorney in Epstein Becker Green's Healthcare and Life Sciences practice based in our LA office. Today's conversation will focus on the government's fraud and abuse enforcement priorities in the wake of COVID-19. We'll discuss some of the high-risk areas we've been seeing to date and also look ahead to some of the enforcement trends we expect to play out in the next several months. As we all know, the COVID-19 pandemic has forced the healthcare industry to rapidly innovate. And for some, that means fundamentally changing how they do business. But with so much focus on adapting to new ways of doing things and doing so quickly, it will be important for healthcare companies to make sure they are also keeping potential fraud and abuse risks on their radar. For example, the expansion of telehealth represents one area where fraud and abuse risk might loom in the background. With the onset of the pandemic came relaxed telehealth rules, which have opened the door for more virtual visits. But it's not clear these relaxed rules are here to stay, and if the stricter standards return once the emergency is over, providers who continue to rely on these relaxed rules are putting themselves at risk. The new funding programs that have become available to help businesses stay afloat during the pandemic are also an area ripe for government enforcement. You've probably heard of the CARES Act, which provides over $2 trillion in aid, a large portion of which was earmarked for the Paycheck Protection Program, the PPP, which provides cash flow assistance to small businesses, self-employed individuals, and certain other eligible entities that have been impacted by COVID-19. To get a scope of the federal money that's out there, based on data from the Small Business Administration, as of the end of June, more than 4.8 million loans have been approved under the PPP, amounting to over $500 billion. Also, as of the end of June, the healthcare industry has been the top recipient of loans under the PPP, receiving nearly 13% of the issued funds. With the amount of federal dollars at stake under the PPP, we expect healthcare providers who receive funding under this program to be subject to increased government enforcement. And even beyond the PPP, we expect government enforcement to increase more broadly. So what does this new enforcement landscape look like? Here to explore that with us are three former government enforcers who are now attorneys at Epstein Becker Green. We have Stuart Gerson, who served as the acting Attorney General of the United States during the Clinton administration, Melissa Jampol, who held former positions as Assistant U.S. Attorney for the District of New Jersey and Assistant District Attorney at the Manhattan District Attorney's Office. And finally, we have Jennifer Michael, who was formerly the Chief of the Industry Guidance Branch in the Department of Health and Human Services, Office of Counsel to the Inspector General. Stuart, Melissa, Jennifer, welcome, and thanks for joining us.
Good morning.
Thanks for having us.
Stuart, why don't you start us off by sharing your thoughts on enforcement risk in the healthcare space in this COVID-19 era?
Thanks, Bonnie. Of course, the False Claims Act is the government's biggest enforcement weapon in conjunction with private relators, qui tam relators. But there are three stages of potential liability that people in the healthcare sector ought to think about. The first are issues with respect to potential fraud in obtaining loans and showing eligibility to get these things and other funding as well. The second is about the use of the money to be consistent with the conditions that are set for it. And the third, particularly with respect to healthcare providers, relates to appropriate billing and coding and designation of services. For example, under the parts of the CARES Act that have provided special funding through HHS for healthcare providers, those providers can only use funds to prevent, prepare for, and respond to coronavirus, and for healthcare-related expenses or lost revenues that are attributable to coronavirus, not anything else. PPP monies are designed to pay the salaries of particular people up to a limit. So high-priced executives whose salaries are higher than $197,000 can't overpay themselves. If money is gotten that shouldn't be gotten, has been the case for a number of entities, it has to be returned promptly within 30 days. So there's potential liability there. Then you consider that you know these things are out there, what are the agencies you're concerned with? Well, of course, the Department of Justice and the Department of Health and Human Services with respect to matters under the False Claims Act, whether they were originally generated by the government or by False Claims Act relators. But beyond that, Bonnie, you mentioned telehealth as an area. Well, $200 million in telehealth support has been issued by the Federal Communications Commission. So that's another area that people need to pay attention to. The Federal Trade Commission is focusing on privacy and security with respect to its consumer law powers. It's uncertain how extensive those powers are with respect to injunctive relief, but that's yet another area where there is potential enforcement and where the FTC has even posted an agenda. And finally, of course, there's the Internal Revenue Service, because there are tax provisions and deferrals that come under the CARES Act programs, and entities have to pay attention to those. So there are a whole bunch of potential pitfalls, and there's a group of federal agencies that are standing ready to pounce on allegations. And with that, Melissa, why don't you describe some specific areas where the government is already acting?
Sure. Thanks, Stuart. I, this morning, Googled PPP fraud for the Paycheck Protection Act fraud. And the first entry that popped up was report PPP fraud dash whistleblower attorney. So it's exactly what you're talking about, Stuart, is we're going to see a lot of enforcement in this area. And indeed, the General Accounting Office at the end of June issued a report stating that PPP loan fraud poses a significant risk due to a number of factors, some of which you've talked about: the number of loans approved, the speed at which those loans were processed, the limited safeguards on the loans, and that there was fraudulent and inflated applications. So what we've seen so far is sort of the low-hanging fruit has been caught by federal enforcement authorities. We've seen an unusual activity in the white-collar space. Usually it takes a long time to do a white-collar criminal investigation. And we've seen a number of prosecutions throughout the nation in terms of people being prosecuted for seeking PPP loans, claiming to have dozen employees when they don't, phantom companies, retiring their personal credit card debt, which, Stuart, as you noted, is not within the bounds of what you're allowed to do with your federal funds that you receive under the PPP, and using it to buy lavish cars and other things like that. Interestingly enough, for healthcare providers, within the last few days, we've seen charges brought by the Department of Justice in cases that are intertwined between PPP loans and healthcare fraud charges. And I expect that we're going to see more of those as time goes on. One interesting thing is that it took years after the 2008 financial crisis for the Department of Justice to bring charges under the then federal relief program, which was called the TARP program, the U.S. Treasury's Troubled Asset Relief Program. And we expect to see in the coming years the full implications of what this rapid release of funds have done throughout the country.
Melissa, one thing that you might also add to that is that if we might very well get a flood of False Claims Act cases, because so many people have been put out of work or are otherwise disgruntled, and they might want to take that out on their former employers. And so that will come a lot faster than what was the case with regard to savings and loans, because there are just so many more people who've been made potential relators.
Well, and when they Google PPP fraud, they'll get exactly what I got this morning. I think you're completely right, Stuart. We're going to see an increase of both civil False Claims Act cases and criminal enforcement. And one thing is that the Department of Justice has stated that they are laser focused on rooting out fraud and corruption linked to the COVID-19 public health emergency. We've seen not only AG William Barr direct federal prosecutors to prioritize the detection, investigation, and prosecution of all criminal conduct related to the current pandemic, and we've seen him create a special COVID-19 hoarding and price gouging task force headed up by New Jersey U.S. Attorney Craig Carpenito. One other thing not to forget is that the state enforcers are likely to get involved in the mix. Don't forget that we have state False Claims Act cases. We also have mini Stark laws. And we expect that those state enforcers who have become increasingly organized over the last few years, focused on fighting COVID-related fraud, as their Medicaid programs get particularly hit by the COVID-19 public health emergency. Any thoughts on that, Jennifer?
Yeah, thanks. I just have one more thing to add, and that is HHS OIG, in addition to working in conjunction with the Department of Justice on False Claims Act cases and other investigations, also has relatively new independent authorities for civil monetary penalties, assessments, and exclusions related to HHS grants, contracts, and other agreements. So recipients that don't comply with the terms and conditions that Stuart mentioned earlier related to the HHS funds they receive also may be liable under those authorities as well.
Now that we have a lay of the land, let's talk specifically about the anticipated increase in qui tam suits. Melissa, how do you think the government will cope with the increased volume?
Well, one way that they will cope is it's likely the Department of Justice will assign additional prosecutors to review these particular kind of cases. And they're reviewed both civilly and criminally under the Department of Justice's current guidelines. There's so much federal money flowing out right now, and there's so much confusion about how to handle that money on the recipient's end. A good example is in the New York area. Hospitals are just trying to figure out how to bill for all the healthcare professionals who jumped in to fight the COVID-19 public health emergency and migrated to the United States. Stuart, your thoughts about how the increase in qui tam is going to affect the government?
You've hinted, Melissa, at what the main change, I think, is going to be. It's always been the case that for every qui tam case that's filed, someone in the civil division at Justice will supervise that case, perhaps in conjunction with an assistant United States attorney. But the added thing that you mentioned is the assignment of or cross-designation of criminal assistants in those cases, so that they're taking a harder look. There's always been a very high rejection rate on the part of the government of these filings in its name, and that will likely continue. But there certainly will be a number of cases where the focus will be more intense, perhaps, than it's been in the past. The cases that really look like violations, very well you could see joint civil and criminal activity in those cases. Indeed, since you can proceed somewhat faster in a criminal case, some of those may take precedence. In addition, these joint operations already have seen cases where companies that are involved in healthcare have tried to make up their losses by overbilling, upcoding, and using the funds that they've gotten for unauthorized purposes. There have already been at least a couple of cases that have been brought, a major one civilly with a very large recovery, and a few criminal cases that you've mentioned. So that's what I see happening.
So one thing I wanted to mention is that Stuart was talking about the parallel investigations between civil and criminal prosecutors. Some people don't know that there are U.S. attorneys' offices who use a provision of the HIPAA Act to be able to jointly investigate civil and criminal cases at the same time. So, for example, the district that I came from, the District of New Jersey, we use what we call HIPAA subpoenas to be able to co-investigate cases with both civil and criminal prosecutors working hand in hand on a given matter, which doesn't normally happen when you begin an investigation with a grand jury subpoena. Jennifer, how is the OIG going to respond, in your opinion?
So given the anticipated increase in enforcement generally, I think there's probably going to be some triaging that has to happen. OIG issued its strategic plan on oversight of COVID-19 response and recovery recently. And the first goal in that strategic plan is to protect people. So obviously that's going to be a focus. The second goal is to protect funds. So OIG also will focus on, outright theft of federal health care funds. But I think in addition to the focus on, what we've talked about as the low-hanging fruit, outright fraud that harms beneficiaries or blatant theft, I think OIG also will make it a priority to focus on other types of perhaps less blatant fraud just for the deterrent effect, while at the same time minimizing burdens on providers. So OIG also recently issued a message from leadership on minimizing burdens on providers. And they said, with respect to conduct during the emergency, the public health emergency, that may be subject to OIG administrative enforcement, that OIG would carefully consider the context and the intent of the parties when assessing whether to proceed with any enforcement action. So I think they're being cautious about striking the right balance between acknowledging the extraordinary nature of this public health emergency and the challenges and confusion that it creates, while at the same time continuing to focus on its mission. Coming up, you'll see a couple of OEI reviews involving telehealth and also a trend analysis of Medicare laboratory billing for potential fraud and abuse with COVID-19 add-on testing. So again, trying to strike that balance between pursuing their mission and ensuring that fraud is managed and enforced, while at the same time minimizing burdens on providers.
Jennifer, how can the healthcare industry mitigate the elevated whistleblower risk and other regulatory risk?
I would say compliance is more important than ever right now. So healthcare entities should be using their compliance programs and their compliance officers to their advantage. Make sure you're doing the right thing. If you find something wrong, fix it. If you identify an overpayment, pay it back. And importantly, if an employee reports a potential compliance issue, investigate it. And if it is an issue, resolve it. Despite what Stuart mentioned earlier about there being more disgruntled employees and therefore more potential whistleblowers, most employees want to do the right thing and they want their employers to do the right thing. And you definitely don't want to be in a situation where you have to explain to the government why you didn't do anything about a significant compliance issue that an employee reported and brought to your attention, but you didn't do anything about. So with that in mind, companies or individuals that have a question about an arrangement, they can look to guidance issued by enforcement agencies. HHS OIG has compliance program guidance documents posted on their website. They're a little old, but they are still good guidance. The compliance program guidance documents are industry specific. There's compliance program guidance documents for hospitals, for pharmaceutical manufacturers, for laboratories, and a number of other industries. However, many of the principles discussed in those guidance documents are universally applicable. So look at a number of them or the guidance document that's most analogous to your business and look at the risk areas OIG talks about and highlights in those documents and think about how they may apply to your business and what you're doing to mitigate those risks. And then finally, HHS OIG has instituted an FAQ process specific to COVID-19 that has some similarities to the advisory opinion process. That FAQ process allows people to submit questions about how OIG would view arrangements that are directly connected to the public health emergency. OIG's answers to submitted questions constitute informal feedback, so they don't provide the same level of protection as a favorable advisory opinion would, but they're still helpful. Also, questions can be submitted anonymously, which is not something that's permitted in the advisory opinion context. And OIG appears to have been responding to these questions pretty quickly, which is also a significant difference from the advisory opinion process, which can often take a year or more. So the FAQs can provide helpful guidance, particularly with respect to demonstrating a lack of intent with respect to a specific arrangement if you're following the guidelines that they've outlined in those answers. Melissa, your thoughts?
Well, in addition to the helpful guidance from HHS OIG, the Department of Justice on June 1st released a guidance called the Evaluation of Corporate Compliance Programs. And this was released by the criminal side of the house at the Department of Justice. But in my opinion, it's equally valuable for those who are facing civil investigations. The point of this guidance is to aid prosecutors in assessing the adequacy and effectiveness of compliance programs when they're deciding whether to prosecute a company, prosecute individuals, or resolve a matter. Additionally, it weighs into whether or not to seek monetary penalties and whether or not to impose a corporate monitoring or reporting obligations. So the actual guidance is structured into a series of questions that the prosecutors will ask in evaluating a corporate compliance program. And I find it to be tremendously helpful in terms of looking at an existing compliance program and seeing for clients where they can do better. The basic takeaway from this revision that was done this year is that companies must ensure that they're flexible and adaptive with their compliance programs. Companies cannot sit back after establishing a program and let it run on autopilot. And this is particularly important at this time of COVID-19, where very often compliance is the first place that gets cut when a company is facing financial problems. In this particular era, we would advise not to do that. Instead, compliance programs must evolve and they must pivot and they must proactively learn about the risks and misconduct within the company and their industry. Stuart, your thoughts?
Well, the single most important thing that a compliance program needs to do in order to satisfy people like I once was, who looked at all these compliance programs in terms of settlements and orders, is to produce outcomes. I mean, humans are basically imperfect, and the company that thinks that it has no problems is not living in the real world. So that if your compliance program is effective and can demonstrate its effectiveness, it will be because it produces outcomes. Another major compliance area, though, that we haven't talked about that's not particularly COVID related, but is getting parallel attention from the government is the Foreign Corrupt Practices Act. Why do you think that I'm mentioning this with regard to healthcare providers? It's because many academic medical centers, pharmaceutical companies, and others in the healthcare space are diversifying their activities with encouragement from foreign governments to set up operations overseas. The Foreign Corrupt Practices Act is an anti-bribery statute. It's a criminal statute, and it's one that the government takes very seriously. In terms of compliance, they're the single most important thing that cases have shown that healthcare entities need to do is have an effective system of background investigations to identify those individuals who are its intermediaries or recipients in foreign countries. Foreign officials is very broadly interpreted in the courts of the United States. And in fact, especially in countries like China, other countries with communist or socialist regimes, virtually everybody is a government employee who these companies will come in contact with. So you have to be very careful and get good counsel and have effective compliance in terms of what funding you're providing and who these people are and what relationships that they might have. Melissa, anything else from you?
I think that the lessons that are learned in the FCPA space, though, are very useful in other kinds of fraud cases. So it's not like they're just confined to the world of the Foreign Corrupt Practices Act, but individual companies who are looking at fraud risks should be thinking about the same kind of issues that are spelled out in the FCPA guidance, which was just updated just a couple of weeks ago.
That's helpful. What other enforcement audit or evaluation activity do you all anticipate we'll be seeing? We heard about the FCPA. Are there other areas that healthcare entities should be worrying about? Jennifer, what do you think?
So yes, the CARES Act established two new Inspector General oversight bodies. The first is the Office of the Special Inspector General for Pandemic Recovery, which resides within the Treasury Department. And that office's duties include conducting audits and investigations related to funds dispersed by the Treasury Department under the CARES Act. The second is the Pandemic Response Accountability Committee, or the PRAC. The PRAC is established within, and it's a committee of, the Council of Inspectors General on Integrity and Efficiency, which is known as CIGI. This committee consists of 21 inspectors general, including the Special Inspector General for Pandemic Recovery and the inspectors general for HHS, the Department of Justice, Treasury, and a number of other inspectors general. Each IG serving on the committee will keep their day job, meaning that each IG will continue to perform their inspector general duties. Right now, Michael Horowitz, who is the Inspector General for the Department of Justice, is the acting chair. And the PRAC is charged with the oversight of covered funds in the coronavirus response in order to detect and prevent waste, fraud, abuse, and mismanagement, and to identify major risks that cut across programs and agency boundaries. The CARES Act empowers the PRAC to refer matters to DOJ for civil and criminal enforcement. The PRAC does not have its own penalties that it can impose. It refers matters to DOJ. The PRAC also has its own website, which is pandemic.oversight.gov. It hasn't yet posted its strategic plan. As I mentioned earlier, HHS OIG has posted its strategic plan related to the oversight of COVID-19 response and recovery. And HHS OIG has stated in its strategic plan that it would conduct audits and evaluations of HHS's oversight, management, and internal controls for the awarding, disbursement, and use of funds, as well as audit fund recipients to assess whether they met the use reporting and other requirements that Stuart talked about earlier. So the HHS OIG strategic plan is pretty high level. It's a short document, about 3 pages of substance. So I would encourage people to monitor the work plan, which is where you'll see the real-time updates about what specific types of audits and other type of work HHS OIG plans to do.
Jennifer, another area that I think the IG is going to be concerned with increasingly is data security and privacy under HIPAA and otherwise. There's been something of a moratorium with regard to sharing information in health records and other such protected health information. That's going to change as we as a society become better to deal with the pandemic. And so among the other compliance functions that healthcare entities need to be concerned with is HIPAA compliance and the sharing of data. I also note that in the cybersecurity area, that hospitals in particular, but healthcare entities also, are the largest single segment of the society that's being hit by ransomware attacks, which generally come in through phishing emails. In other words, at the weak link of everything, human beings. And so compliance needs to pay attention to that as well as overall HIPAA compliance.
From the Department of Justice's side, I would expect us to see increasing prosecutions focusing on wire fraud, where money is moving across state lines. We've seen the first security fraud case connected to COVID-19 brought. And we've seen the Department of Justice, as I mentioned earlier, focusing on healthcare fraud cases. Most notably, there was a case charged in the District of New Jersey that in the criminal complaint quoted the charged defendant telling a cooperator that, quote, everyone has been chasing the COVID dollar bird. So with a lot of money, there's a lot of opportunity for people to attempt to evade the law. And we're going to see the Department of Justice focusing on that. Jennifer mentioned earlier that OIG has added both telehealth and clinical laboratory matters connected with COVID-19 to its work plan. Those have been very hot areas for criminal enforcement. And I think that we're going to see increasing prosecutions related to COVID-19 testing. Not all of it is being done the way that the government wants it to be. The government's a little bit confused about how they actually want it to be done. So that's adding to the mix here. And a lot of this is intermingled with telehealth, which with 2 big enforcement measures in the telehealth space last year, in the DME space and the genetic testing space, the government has been devoting a lot of resources to. Stuart, your thoughts?
Well, I mentioned earlier that there were $200 million of designated telehealth money that is being funneled through the Federal Communications Commission. We don't normally think of them as a regulatory agency with regard to healthcare, but we have to now. In addition, I think that this is an election year, and the PPP program has not been a great success with regard to funneling money down to Main Street businesses. This doesn't have anything to do with healthcare, but what it means is that there's going to be a lot of pressure in the election year, in this election cycle, to show activity. One of the most controversial things that occurred with the onset of the CARES Act was the president's dismissal before he even started of Glenn Fine, who was the Department of Defense Inspector General, who had been designated to be the overseer of the whole COVID program. Well, there isn't any such person now. There's someone in the White House. But what it means is, to advert to what Jennifer was talking about, is that there are a bunch of IGs out there who are taking this seriously and know that there is something of an enforcement gap that they will fill. The same thing is true of United States attorneys. And they see political advantage, besides it being consistent with the law and the administration of justice, to pursue these kinds of cases with some vigor. There are entities out there who will be under the microscope. The government has always been interested in trying to increase its reach to evaluate what it says are unnecessary services. That's always highly debatable, but in the COVID environment, it may be a little easier, where monies are used for things that don't strictly conform to what it is that the CARES Act provides for. So it's a time of heightened risk. It's certainly a time, as Jennifer lucidly pointed out, to emphasize compliance. It's a time to pay attention.
Thank you all for taking the time to speak with me today. We covered a lot of ground.
Thank you.
Thanks, Bonnie.
Thanks, Bonnie.
And everybody.
So to recap today's conversation, COVID-19 funding programs have brought a significant amount of money to healthcare companies, but if these funds are not handled in a compliant way, there is a risk of government enforcement, and there's various government regulators involved here. We have the DOJ, OIG, FCC, FTC, IRS, in addition to certain new oversight bodies that have been created in light of the pandemic. And the government has already started initiating enforcement actions aimed at fraud and abuse related to the COVID-19 response. These enforcement efforts are expected to continue and ramp up. In particular, we expect to see an increase in key TAM suits and wire fraud cases. We also expect to see increased government scrutiny around FCPA and HIPAA compliance, also in the telehealth and lab testing spaces. The government's focus now is on more egregious conduct, but later we can expect less egregious conduct to also be under the microscope, and the government will carefully be considering the context as well as the intent of the parties. And finally, as government enforcement ramps up, healthcare organizations will need to ensure their compliance programs are on point. They will need to be diligent about addressing issues raised by employees and not simply run on autopilot. They'll have to examine the federal and state rules that apply to their operations and keep tabs on the quickly changing regulatory landscape. Thanks very much for tuning in to Diagnosing Health Care. We hope you join us again soon.
Thank you for listening to Diagnosing Health Care. For show notes on today's episode, additional episodes, and more insights on trending issues in healthcare, please visit diagnosinghealthcare.com and be sure to subscribe on your preferred platform. The Employment Law This Week and Diagnosing Healthcare podcasts are presented by Epstein Becker Green, PC. All rights are reserved. This audio recording includes information about legal issues and legal developments. Such materials are for informational purposes only and may not reflect the most current legal developments. These informational materials are not intended and should not be taken as legal advice on any particular set of facts or circumstances, and these materials are not a substitute for the advice of competent counsel. The content reflects the personal views and opinions of the participants. No attorney-client relationship has been created by this audio recording. This audio recording may be considered attorney advertising in some jurisdictions under the applicable law and ethical rules. The determination of the need for legal services and the choice of a lawyer are extremely important decisions and should not be based solely upon advertisements or self-proclaimed expertise. No representation is made that the quality of the legal services to be performed is greater than the quality of legal services performed by other lawyers.